Our next session is really going to be talking about, again, resilience in the post-digital era, but really from the perspective of the CISO. And, who better than to get to talk about that than two very experienced CISOs? I would like to turn it over to Marc Johnson and Dave Duclos to introduce themselves and kick off our next session.
Thank you, Lisa. Get the presentation up here so everybody can see what we're talking about. All right. So again, resilience in the post-digital era, rethinking cyber strategy for healthcare. Thank you for joining us today. What we'll be going through really is a series of fireside chats, but we've organized them around strategic context, market pressures, points of view, and then strategic pathways, and ultimately investment alignment. So as we do that, Marc Johnson, Impact Advisors, security and privacy practice lead, and I work with Mr. Duclos daily, and he's the deputy CISO of CHRISTUS Health. David, did you want to say anything?
No, good morning or good afternoon, depending on where you are in the world. But I did have to, I'm just going to take 2 seconds and just pound my chest, even though I live in Dallas. Originally from Boston, as you can see with the Fenway Park behind me. So go Patriots. It's a great win over our Houston, Texas. But thank you so much. Appreciate the invitation, Mark, and looking forward to our chat today.
Excellent. So as we think about, what's going on in the clinical and operational world in your space, when you talk with the clinicians and the operational leaders, what do they most misunderstand about cyber risk?
Great question, Mark. And I would say that traditionally, I think people think cyber risk is an IT problem rather than clinical, operational, financial. If we were to talk about some of the things they think is they believe it's data theft. That's our biggest issue we worry about is data theft versus availability risk, right? Downtime of systems by ransomware. We all know, and we'll probably be talking in a few minutes about ransomware, which is kind of how we've gotten to where we are today, unfortunately. And then that other thing called integrity risk, right? Is our lab images, have they been altered? Medical records, have they been altered? So I think everybody just thinks somebody's coming and stealing your data, but they don't think all the other prongs, right, that are there. And then I would say that there's too many people who still think that cyber risks are rare per se. Never going to happen to us. When in reality, I'm not sure we're the number one targeted threat vector today, but if we're not, we're in the top 3.
Excellent. Okay. So as we give some context to what we're going to talk about today and some of the questions and answers, we all know that there's escalating cyber threats and it's about prevention, but what about disruption? How do we, make sure that we can get through it? So when you consider, how cybersecurity has evolved within our businesses and within healthcare, when did cybersecurity move from an IT concern to a patient safety issue, at least within CHRISTUS?
Yeah, another great question. I would say for us, we recognize that system outages and cyber incidents that directly delay patient care or can disrupt anything in a clinical setting is putting patients at risk. So, we just talked about ransomware. Everybody remembers probably, a blink of an eye seems like a short time some days, but in this business, a blink of an eye, things happen pretty quickly. WannaCry is the big one I can think of that goes back not too long ago, causing many disruptions, right? So when you look at what happens in a clinical setting, many people, you go from electronic coding, you lose your EHR. Think what happens for people who've ever been unfortunately involved with something like that. Delayed surgeries. Imagine, you've taken time off from work and you're ready to have a colonoscopy, or you're having some kind of day procedure, and you get a call that, I'm sorry, Mark, we can't have you come in today because we've had a cyber attack. Diverting patients, right? We've seen that where ERs are down and they have to divert to other hospitals, right? So when you look at all that stuff, I think leadership now, I would say today at CHRISTUS, we are much more aligned with what potentially could happen to cause clinical harm than some of the other things that maybe were benign in the past.
Excellent. Okay. So how do you help non-technical leaders internalize those cyber events as operational disruptions rather than abstract threats?
Yeah, again, I think it's, trying to describe that technology failures have to translate to business interruptions, right? Even for board members, which we'll talk later. You need to put it in layman's terms or some kind of language that they can understand, right? Because not everybody's technical. So you got to, I use the word dumb it down. You got to dumb it down and put it into words that translate. So for a ransomware event, as an example, you're probably going to try to tie that to the impact it might have on a hospital or a clinic. Or unfortunately, it could be an enterprise-wide. If most of us on the call here probably know what happened with Change Healthcare. That was catastrophic to their business, and it had a ripple effect to lots of people, including us at CHRISTUS. You could take a cloud outage and say that's equivalent to losing all your utility electrical power at a particular location. You could take a data breach and say lost customer trust, right? Or a regulatory fine, that old three-letter word called OCR. That resonates when you start talking about money. That resonates with non-technical people.
Excellent. Thank you so much. So as we look forward to what pressures are in the environment, we know that certainly we've got a lot of patient care disruption we've talked about. We also have the third party exposure, if you will. So let's talk about that a little bit. Third party and vendor exposure keeps coming up all the time. So where do healthcare organizations still underestimate that risk?
Yeah, unfortunately, I think we still have some blind spots out there showing up, whether it be real incidents or even through internal audit. And I don't think the issue, Mark, is awareness per se. I think it's where assumptions replace verification. So what do I mean by that? So if you look at like non-clinical vendors, sometimes are assumed to be low risk, although we may be focused on EMR systems and imaging systems and medical devices, but there's other things out there that you have revenue cycle, you have third-party billing and collections organizations, right? Do they not handle PHI, PII, maybe even PCI, right? The answer is yes. Do they not have access a lot of times to our networks? The answer is yes. How many times have people seen shared accounts? And, it's easy to go in and look at your own ecosystem and say, we have all these tight controls and things in place. It's a whole different dynamic because you're putting a lot of faith and trust into third parties that you can't go all the time, if at all, a lot of times, and do that same kind of due diligence. So I think that's one area. I think sometimes we over rely on the reports we get from people, right? SOC 2 reports, or you send out a vendor risk management 100 question, whatever, and you're trusting and assuming that what you're getting back is real. And it could be a point in time that who knows what has changed since then. So I look at some of those things, and those things give me a little bit of anxiety, making business continuity assumptions relative to do they have the right things in place? Do they have the right things within their contracts for business continuity? How are they going to recover from a ransomware event? So when I look at a few of those things right there, ultimately the third party risk is probably what keeps me up most within the CHRISTUS ecosystem today, because we just have so many third party relationships, and unfortunately you can't get as deep into their systems that you would if you could go and touch your own data center, if that makes sense.
Absolutely. So as we start to look at, what the board level objectives are, certainly patient care is top of the list, but we have to also understand preserving financial stability, revenue, and so forth. So how do you translate the technical cyber risk into language that the boards can actually act on?
Yeah, great question, Mark. I would say, in my opinion, boards aren't acting on technical risk. They're really acting on business risk, confidence, accountability, right? So our job, right, as CISOs or techies, is how do we translate that cyber risk into a unit of measure that, without dumbing it down per se, that they can better understand, right? Boards don't want to hear that we have unpatched vulnerabilities and increased lateral movement. That doesn't mean a lot to somebody who doesn't work in that arena day in and day out. What they want to hear is, as an example, maybe a ransomware event or incident caused a shutdown of order processing for medical supplies. Maybe that was a 3 to 5 day event, and let's just say a rough number of $18 million in revenue, and maybe it triggered some regulatory notifications. A board member can understand that without knowing what vulnerabilities and risk management and patch management and everything else is, right? So it's, how do you take three components like threat, tie that to an operational impact for them, vulnerability, tie that to a likelihood that it could happen, a control gap, tie that to the exposure that could cause. Something else is anchor things to your company's core value drivers. So typically most boards are driven by revenue, regulatory exposure, safety, strategic execution, and most importantly, brand reputation, right? Right. Again, I come back to the Change Healthcare, major brand reputation right there, regardless of all the things. I'm not trying to pick on Change Healthcare today, by the way, for everybody. It's just one, unfortunately, that hit everybody pretty hard.
Yeah, you bring up a good point, though, that Change Healthcare wasn't necessarily an IT issue from an internal CHRISTUS perspective. It was a business level decision, and therefore there wasn't a thought on, I need to have a secondary. I need to have another way to handle it, whether that's getting loans in advance and understanding I need to enact those. So no, I think
absolutely. And I would just add one more point to this is, everybody has skin in the game when it comes to cybersecurity. Cybersecurity involves everybody. It's not an IT centric responsibility. So making sure that boards know that, who's part of this, who's the business owner. It's usually not an IT person. Who has accepted a risk status. That doesn't always mean it's an IT person. It usually goes back to the business. And if there's a decision required, depending on the complexity of the risk that needs to be accepted, that should make its way. It could make its way to the board at some point, depending on how big of a risk we're going to accept, right? So I think if you take all those elements and combine it together, making everybody feel like we're all rowing the same boat, and it isn't Marc Johnson as a CISO that's responsible for all of those things right there.
Excellent point. So as we transition and look at aligning to those board level objectives, there are 5 basic pillars to the resilience: patient care, continuity, trust, innovation, and resilience as a program. Or is it a program? Do you see resilience as a program or as an operating principle?
So I'll just give you Dave's short answer. I think the most effective organizations would treat resilience as an operating principle, even though you're building on it through programs, but I believe that's an operating principle. And here's a few reasons why. Resilience as a program, it's necessary but limited. So what do I mean by that? Programs they're going to get funded and organized based on traditional things like business continuity, disaster recovery, cyber incident response, right? So what are some of the strengths of that? You got clear ownership of budgets, measurable milestones, regulatory and audit alignment. However, you can get siloed. It's very easy to get siloed. They're not always optimized for known scenarios per se. And a lot of times I've found that you're working off of things from the past. So you're always behind the curve, like working off of last year's crisis versus what's happening right now in your short-term radar. So to me, a resilience program, you're literally operating principle on how you making decisions every day. It's more tactical versus this long-term look at the past type things. So your design decisions are probably more modular in nature, graceful degradation, redundancy where it matters. Your operating rhythm is probably you're doing more frequent drills, as an example, versus, hey, every 2 years we'll do something when we can do it. You're doing post-incident learning on a more regular basis, rapid escalations where you need to. And then I think from a leadership perspective, and some of this is probably the psychological safety factor is, I think you get better clarity under stress. You have fast authority shifts. And ultimately, you're not just responding well to the shocks that may happen, the speed bumps that may happen. You're expecting them. You're designing for them. So instead of an afterthought being reactive, you're being extremely proactive, in my opinion.
Excellent, excellent. So as we start to make it more tactical and turn the operational principle into a model, into action, we certainly have to anticipate, we have to withstand, we have to operate, recover, but more importantly, we have to adapt. So why do most organizations only think about the recovery component and forget about operating through that disruption?
Yeah, exactly, Mark. I think it's a subtle, critical distinction. Most organizations, they're focused on recovery because it's simple to define, simple to measure. I'll say simple to fund. It probably depends on the size and scope of your organization. Operating through disruption is a lot harder, both conceptually and practically. And some of those reasons are recover is discrete, where operate through is continuous. So if you're in recovery or recover, typically they have a clear incident starts, and then you have a business restoral, right? It's pretty cut and dry. It fits neatly into most people's plans and budgets most of the time, and their playbooks. They have documentation surrounding it. It's something that could be easily measured, right? With metrics, downtime metrics, cost to restore, your SLA, breaches, and things like that. Where operate through, again, requires how will I coin it? Operating more under stress conditions. It overlaps with the unknowns of the unknowns. We don't know what we don't know sometimes until it actually happens, right? Harder to measure, right? We're in partial functionality versus we had an outage, we did a full restoral, right? Which is what we were talking about a second ago, versus this is kind of fluid. We're bringing certain things up. Not everything's back to normal, but we still have some things that are operational. You don't have this really easy checklist. You can just go down and go, yep, if that makes sense. So to put it in, if you were to put it in like a firefighter's world, it would probably be the difference between a fire drill that you can quickly, that's a quick recovery, versus you got a building on fire, but while it's burning, you're still operating through. Maybe you got this huge plant, you got things you can still operate in without having your entire business like collapse and you can do nothing. So a little bit fuzzier, a little more things to think through. I think you got to have some pretty decent critical thinking skills if you're going to operate in that methodology. But to me, I think there's some value as we continue to mature and evolve. And ultimately, I heard some of the other gentlemen talking earlier. We constantly are under the microscope to, unfortunately, we always got to get it right. The bad guys only got to get it right once. We have to be perfect. It's not even close to an equal playing field, and it means that we can't always rely on all these traditional ways of fighting against bad guys. It's not somebody sitting in their mom's basement anymore, right? It's highly organized, worldwide crime.
Yeah, absolutely. So, yeah, I mean, the OR and ER just simply can't stop, right? It's not like a lot of verticals. So, no, absolutely agree. So what are the strategic ways that we can go about this? And there's multiple different ways. And so, we're really looking at, how do we understand what we need to attack and what we don't need to attack and so forth. So cyber risk quantification or, cyber value at risk sounds powerful, but where does it most help? Does it help in budgets, boards, or prioritization?
Yeah, great area here. I'm glad you're challenging my gray matter today. So thank you, Mark, for that. So CyVAR, I think it depends on how it's used, right? You just talked about it, right? It could be used across budgets, boards, and prioritization. I think the sweet spot is prioritization. There's trade-offs to all three, but here's why I say that. I think being able to take and translate cyber risk into potential financial impact, making abstract threats tangible, right? It allows leaders ultimately to compare different buckets, or let's say a bucket of apples to apples. If I had let's say a ransomware event versus an insider threat versus a cloud misconfiguration, right? Mm-hmm. If we can fix anything, where does the dollar for each risk mitigation go to? I don't know. But if I could take that and say, I got a ransomware event that has a CyVAR of $20 million, got a CyVAR of $20 million for risk A. Then I have risk B, which might be some kind of phishing incident. That's $5 million. Well, if I'm looking at CyVAR, I'm likely, and I'm sure there's a lot more into the details if you got the weeds on this, but from a high level, I'm going to put my mitigation priority towards risk A, which would be that $20 million ransomware event.
And then you're also talking CFO's language, right?
Yeah, right. So I guess it avoids what they call it, the bright shiny object syndrome, where high visibility but low impact risk that consumes resources versus driving data conversations between security, risk, and operational teams, looking at those kind of financial metrics.
Excellent. So we talked a bit about investment and how to align it. So what don't you want to fund in cybersecurity, or how do you decide what not to fund?
Great question, right? Again, great question. Honestly, you got to take some kind of a risk-based strategic approach to this. I think CyVar, which we just talked about, offers a model that you can look and say, okay, here's some areas where I want to try to concentrate my efforts on. I think you need to look at potential losses or likelihood for potential losses. I think most people would probably agree, low impact, low likelihood events are probably not the area you want to aggressively be charging forward with. Doesn't mean that something can't happen. The problem is you never truly can eliminate risk, right? I always say you're trying to move it to the left and down, where left is like the worst of the worst. It's purple if you were looking at like a matrix, versus I want to move it to the yellow and green. But if something connects to your network in this world we're involved with today, you can never say that the risk is gone. I think you got to align, and we talked about it earlier on one of the slides. With most of this is how do we align with the board, right? And getting the board to buy into things, putting things into some kind of language that resonates with them, and being able to serve up your risk appetite to the board on how much risk is acceptable, right?
So is that where the Privacy and Information Security Committee comes in within CHRISTUS, is making that communication channel better?
Yeah, absolutely. We call it a PISC, or we're all full of acronyms in this business. So our Privacy Information Security Committee gets together quarterly and is represented by different stakeholder, different verticals within our healthcare organization. So legal, clinical, compliance, privacy, risk management. And that's where we sit and we talk about some of these big issues of what are some of our bigger risks? What are some of the trends that we have seen? What's the likelihood and impact of some of these things, including evolving like the new HIPAA security rule proposals as an example. So how do we take some of that and present that to the board? Because we're not going to get everything, right? I mean, we kind of put our Santa Claus list together and say, here's really what we'd like to have. But at the end of the day, it's that balancing act, right? It's kind of like I heard somebody talk about zero trust earlier. And it's like zero trust isn't this shiny object you can go buy this appliance and you plug it in and it fixes everything, right? So I think those are some of the things. But a couple other things, Mark, that you got to worry about is if you build it, will they come, right? So I call it the operational or sometimes political resistance, right? So this PISC committee has really helped break down some barriers and help people better understand why we try to do some of the things that we do. It's not to be, we're a Catholic healthcare organization, so we refer to our hospitals as ministries. I joke and say, cybersecurity, we're the ministry of no. Hey, I'd like to open this up. No. We really are problem solvers. And I think trying to get out of that mentality of we are not the bad guys. We really want to be the ministry of yes, but we need you to partner with us so that we're doing the right thing and everybody is got a seat at the table.
I appreciate that. Well, it looks like our time has come to an end. So I want to say thank you to everybody out there for listening. And I know we didn't get to some of the questions. I had a lot of questions to get through as it was, but want to make sure that we turn it over to the right people at the right time.
Thank you, Mark. Appreciate the opportunity today.
Thank you.